Jerry, that was great. Joe, do you want to take on the next piece here?
Hi, everyone. I'm Joe Wagner. I'm the Managing Director of Fenton Communications for our Washington office. For those of you who don't know about Fenton, we are a social change communications agency. We're going to be celebrating our 35th year in business this coming February. And I've been at the company for 3.5 years. My background is in media relations, specifically healthcare communications. I've done a lot of work with providers and payers and advocacy organizations across the healthcare spectrum. And what I want to talk to you about today is some research and messaging that we did for the Bernard Van Leer Foundation in 2011 and 2012, which is what the National Academy of Sciences asked me to speak about today. And just to give you a little more background about before I get into that, some of the other more recent clients that we've worked on in terms of addressing violence in children. In addition to the Bernard Van Leer Foundation, I work with the American Academy of Pediatrics on a gun safety campaign. We've worked with the Robert Wood Johnson Foundation on their Adverse Childhood Experiences campaign, and we work with Sandy Hook Promise on educating policymakers, media, and other constituents on gun safety, especially when there are mass shootings. But let me talk a little bit specifically about the research findings. We were hired by the Bernard Van Leer Foundation to develop a communication strategy to advance the foundation's goal of reducing violence in the lives of young children. The intention was for the findings to serve the foundation both in orienting its investments and other organizations as well as its own communications. The goal was to mobilize greater, more sustained public and political engagement for the prevention of violence in young children's lives by raising the visibility of this issue through compelling, urgent, evidence-based, tested, and developing an actionable narrative for why preventing violence in young children's lives matters and the potential for preventing violence before it begins. Our target audience was global. We didn't have a specific set of audiences, but we wanted to reach elite opinion leaders, influencers, and policymakers. So we came up with a training and an interview guide where we interviewed 18 influencers from fields of business, government, media, cognitive science, politics, philanthropy, law enforcement. We had a Nobel Peace Prize winner, activists, domain experts in women violence, public health, to find out 3 things. 1, what they knew about violence in the lives of children. 2, how they talked about it. And 3, what could move them to action. So I want to talk about some of the key findings. In general, people knew very little about the issue or its solution, and there was a mixed reaction to the arguments we tested. However, no one doubted that violence in the lives of children is a big problem that we must tackle. So, some of the specific findings is most people knew very little about, quote, violence in the lives of children as an issue, its nature, its scale, its effects. Even very well-informed people who were otherwise expert on development, children, and nutrition. There was little understanding of the effects on brain development or physical health. Most people mentioned emotional trauma or further violence. Most people only mentioned in the home as a place where violence happens, not schools or communities. Most people had strong, often personal reactions to the issue. They tended to find it overwhelming, and it often triggered personal stories. Few could name a successful violence prevention initiative, whether child-related or otherwise, although nearly everyone hypothesized that violence should be preventable through a combination of legislation and changing social norms. Nor did they know that meaningful change was achievable within 2 years. Most people thought it would take 10 years or even a generation before we'd see some real difference. Terms like child protection or child protection systems were universally disliked by the native English speakers we interviewed, while almost everyone liked toxic stress. Non-native English speakers did not understand either phrase and found the UNICEF language protecting children from abuse, exploitation, and neglect much clearer. Keeping things positive, interactive, and focused on the children was highly effective. At our interviews in Davos in Peru, bringing in children's voices, live or via video, maintaining a positive, personal, or playful tone, playing cheerful music, telling stories about personal experiences with children, and including an interactive element, an exercise we used toy bricks, or a demonstration, a live interruption during a presentation were all elements that worked extremely well. Giving solutions a name helped enormously. Participants were a little overwhelmed by the 7 WHO strategies, but responded very well to Ring the Bell and Violence Interrupters from Cure Violence, which served as useful shorthand. And just so everyone knows what the World Health Organization's 7 strategies are, it's 1, supporting parents and caregivers, 2, developing children's life skills, 3, providing support services for victims, 4, reducing harmful use of alcohol, 5, limiting access to weapons, 6, empowering women, 7, changing cultural and social norms. Some of the other findings: no one doubted that violence in the lives of children is a widespread global problem. In fact, many people remarked that published statistics are likely to be too low. Nearly universal understanding that violence happens in families of all economic status, but stressed that rates are likely to be higher in low-income families because of stress. Many people had surprisingly skeptical reactions to scientific and economic arguments. Many people questioned the assumptions or the numbers, or simply didn't believe the link. The most popular arguments were moral, cycle of violence, and economic. So those were the research findings. We then came up with key messages to emphasize, and those included violence affects children whether it's felt directly or merely witnessed. Violence affects children in communities and schools as well as in homes, and violence affects rich families as well as poor families. Violence can be prevented. The key aspects to emphasize are major reductions can happen in a short period of time. These solutions are proven, and again, we refer to the credible sources such as the WHO or medical journals. And cultural change and supporting parents are 2 key parts of the solution. Some arguments that we recommended for tackling the problem is that dealing with violence now will save money later. We must break the cycle of violence. Dealing with violence now is good for adult health. Dealing with violence helps address economic inequality. Early prevention is more effective than late cure, and physical discipline doesn't work and may harm. So then we came up with some messaging recommendations based on the findings from these interviews, as well as a media analysis that we did. And our basic recommendations were communicating with people in positions of influence who are not experts on violence in the lives of young children and with the media. So our recommendations include making sure that we define the issue, but don't spend too much time persuading an audience why it's a problem. People instinctually know it's a problem and are thinking about how it depresses them or triggers their own experiences with the issue. Instead, we recommend focusing on a message that violence can be prevented, sometimes in relatively short periods of time. We want to define what we mean by violence in the lives of young children, spending a little bit of time, about 10% of the messaging here. We don't want to worry about specifying or defining young children. We found that this detail did not affect our interviewees or the journalists' interest. We want to make sure that audiences understand the scope of the issue includes the effects of witnessing domestic violence, growing up in a violent neighborhood, and corporal punishment in schools. Most of the people we interviewed were mostly focused on violence in the home and had to be prompted to include these other locations. People strongly pushed back on the argument of violence against pregnant women as violence against children, not because they didn't think it was wrong, but because they thought it was a slippery slope to personhood of a fetus, which has ramifications in the abortion debate. We want to make sure that audience understands that violence in the lives of young children is a global issue. It happens in both rich and poor families and communities in every country. Most people tended to associate the issue with families under economic stress. We recommended that we link the problem and its solutions to what our audiences care about or work on. For example, violence against women is closely linked to violence against children. Microfinance combined with gender norms training has been shown to reduce violence against women. We want to help the audience understand that they can do something about violence against children by continuing or amplifying the work they already do on other issues and showing them that they can get more resources for their work by making that connection. And I want to let everyone know this full report can be found online at fenton.com. /files, Fenton Bernard underscore BVLF, which is the Bernard Van Leer Foundation _report. Thank you all very much.